All right, future nurses, you gave us a ton to unpack with this 4-hour NCLEX masterclass.
Oh, yeah, definitely.
Let's extract those golden nuggets, the ones that'll really boost your confidence for the exam.
Absolutely. And one of those high yield areas that the instructor hits hard is acid-base balance.
They definitely weren't messing around.
No, they were not.
But amidst all that info, I caught a great tool for remembering how to interpret those lab values.
You're talking about the ROME acronym, right?
Yeah.
Respiratory opposite metabolic equal.
Yes.
That's going to be super helpful when you see those questions about pH, CO2, and bicarbonate.
Totally. It's like a cheat code for those "what imbalance is this" questions.
Right.
They even threw in practice scenarios, which is awesome.
Oh, nice.
Like, imagine you see a patient with a pH of 7.28 and a high PCO2.
Okay.
What's your nursing spidey sense telling you?
That's classic respiratory acidosis.
Yeah.
But here's where the NCLEX can be tricky. It's not enough to just memorize ROME. You have to understand why it works.
So help me connect the dots here. High PCO2, that means.
It means there's too much carbon dioxide in the blood, which is making it more acidic.
Okay.
Think about a patient with COPD, for example.
Right.
Their lungs aren't removing CO2, effectively leading to that buildup and the drop in pH.
Okay, that makes sense. And I remember the video also mentioned something about acidosis causing headaches. I'd never linked those two together before.
It's all about how sensitive the nervous system is to pH shifts.
Uh-huh.
Even a slight increase in acidity can trigger those headaches.
Wow.
And here's another crucial connection for you. Acidosis can mess with potassium levels.
Now, potassium imbalances, those are serious.
Absolutely.
Tell me more about that link.
Right, you've got it. Acidosis often leads to high potassium or hyperkalemia,
Okay.
which can spell trouble for the heart.
Yeah.
The NCLEX loves to throw in those curveballs where an acid-based problem turns into a cardiac risk.
So it's like a chain reaction, and one imbalance can set off a whole cascade of issues.
Exactly. The NCLEX wants to see that you can think critically and connect those dots, not just parrot back facts.
Got it. Critical thinking is key. Now, let's move on to another topic that felt pretty intense in this masterclass. 4V therapy. So many details packed into that section.
It definitely highlights how important IV therapy is for nurses.
Yeah, for sure.
And what I found fascinating was how this instructor balanced those need-to-know basics with little clinical pearls you often only pick up on the job.
Right, like that bit about never writing directly on an IV bag with a marker.
Right.
I'll admit that's something I probably would have done.
It seems harmless, but that ink can actually seep into the solution and contaminate it.
Oh, no.
Not something you want happening to your patient.
Yikes. Definitely wouldn't want to be on the receiving end of that. So, note to self. Labels, not Sharpies for 5E bags.
Exactly.
Yeah.
Now, another detail they covered that often trips students up is choosing the right 5E gauge.
Okay.
It seems counterintuitive, but a smaller gauge number actually means a larger needle diameter.
Yeah, that always messes me up. Why is it like that?
It's all about the size of the lumen, the hollow space inside the needle. Think of it like a garden hose. A wider hose allows more water to flow through.
Okay.
So a smaller gauge number means a larger lumen, which translates to faster fluid delivery.
Okay, so a 24 gauge needle would be like that tiny garden hose for a delicate flower bed, and an 18 gauge is more like the fire hose for, well, emergencies.
Perfect analogy.
I like it.
And speaking of what we put through those IVs, they covered all those different types of solutions. Isotonic, hypertonic.
Yeah, that's a lot to keep straight, especially when the pressure is on during the exam.
Absolutely. But instead of trying to memorize a chart, think about the WHY behind each solution.
Okay.
For example, when you hear isotonic like normal saline, your brain should go to same concentration as body fluids.
So if a patient is severely dehydrated, isotonic solutions are your go-to for replacing those lost fluids, right?
Exactly.
Make that.
And they also point out that while lactated ringers is also isotonic, it's often preferred for situations like burns or severe diarrhea where there's a loss of both fluids and electrolytes.
It's those little distinctions that can make a big difference on the NCLEX.
For sure.
They even delved into the nuances of microdrip versus macrodrip IV sets.
Right. Microdrip for precise infusions, like in pediatric patients, where even small changes in fluid volume can be significant, and macrodrip for when you need to deliver fluids quickly, like in a critically ill patient.
And of course, we can't forget about the dreaded potential complications of IV therapy.
Right.
They highlighted air embolism, infiltration, phlebitis.
All things you definitely want to be able to recognize early on. Remember those signs and symptoms like pain, swelling, redness at the IV site?
And then there's compartment syndrome. That's a whole other level of scary.
It is serious, but being able to spot those early warning signs Pain out of proportion to the injury, swelling, tightness, changes in sensation can make all the difference in preventing permanent damage.
So much valuable information packed into just that one section on IV therapy. It's clear why this is such a high-stakes area for nurses.
Absolutely. Mastering 4 therapy is essential for acing the NCLEX and providing safe and effective care to your future patients.
Okay, shifting gears from those IV intricacies, this masterclass also took a deep dive into parental nutrition, which felt like a whole other world.
It's definitely a specialized area of nursing, and this section was jam-packed with details about PPN, TPN, all those different components.
It felt like trying to memorize a recipe with a million ingredients.
Right.
But one thing that helped cut through the jargon was the emphasis on the why behind parental nutrition.
Right. It's not just about randomly pumping nutrients into someone. It's about providing life-saving support when the GI tract isn't working properly or when a patient can't get enough calories orally.
The video did a great job comparing PPN and TPN when you'd use one versus the other, the different veins involved.
And crucially, they highlighted the safety aspect, especially the risk of hyperglycemia with those high dextrose PN solutions.
Which makes sense. It's like mainlining sugar. I remember they even mentioned using a Y connector if you're adding lipids to the main IV line. Why is that little connector so important?
It's all about preventing complications. Mixing lipids directly into the PN solution can cause clumping or separation, which could lead to a dangerous blockage in the IV line. The Y connector ensures they mix properly right before entering the bloodstream.
So it's all about maintaining that smooth, consistent flow of nutrients. And of course, there's always the potential for complications with any invasive procedure. They talked about pneumothorax as a risk with central line placement for TPN.
Right, that's why knowing what to watch out for is crucial. Sudden shortness of breath, chest pain, those are red flags you can't ignore.
Early detection is key. Speaking of things we want to catch early, let's move on to diabetes management, another hefty section in this masterclass.
And true to form, the instructor had a handy mnemonic for remembering those classic diabetes symptoms. The 3Ps, polyuria, polydipsia, polyphagia.
Easy enough to remember, but what's really helpful is that they didn't stop there. They explained the physiology behind those symptoms.
Exactly, because understanding the why is how you truly make that knowledge stick. Polyuria excess urination happens because the body's trying to get rid of that extra glucose. Polydipsia excessive thirst is the body's way of trying to compensate for that fluid loss. And polyphagia, or increased hunger, occurs because the body isn't able to use glucose for energy efficiently, so it's constantly craving more fuel.
It's like solving a mystery. Each symptom provides a clue to what's happening inside the body.
And then, of course, we can't forget about insulin, the cornerstone of diabetes management. The video covered all the different types: regular NPH, rapid-acting, Lispro.
So many options. It can be hard to keep them straight, especially those onset, peak, and duration times.
Right. But they offered a great memory trick for that: 1, 2, 4, 6, 8, 10, 12, for remembering the onset, peak, and duration of regular and NPH insulin.
So much easier than trying to memorize a whole chart. Speaking of things that can feel overwhelming, let's talk about diabetic ketoacidosis.
DKA is definitely a high-stakes complication, and the NCLEX loves to test your knowledge on it. One crucial point the instructor hammered home was that ketones in the blood confirm DKA, not just in the urine.
So someone could have ketones in their urine and not be in DKA. That seems counterintuitive.
It's all about where those ketones are being detected. Ketones in the urine might indicate that the body is starting to break down fat for fuel, which can happen during periods of fasting or low carbohydrate intake. But when ketones build up in the bloodstream, that's when things get dangerous, signaling that the body has shifted into that acidic state.
Okay, that's a crucial distinction. They also went over those classic DKA signs and symptoms: dehydration, cuspal breathing.
Cuspal breathing, that deep, rapid breathing pattern, is the body's desperate attempt to blow off excess acid, trying to restore that pH balance.
It all comes back to acid-base balance. This masterclass is really highlighting how interconnected everything is in nursing.
Exactly. The human body is like a complex puzzle, and nurses need to understand how all those pieces fit together.
Speaking of interconnected systems, this masterclass didn't shy away from another potentially intimidating topic: blood transfusions.
And rightfully so.
Yeah.
It's a high-risk procedure. But what I appreciated was how the instructor broke down each step, emphasizing those crucial safety checks that are essential for preventing complications.
Right, like that big one, only using normal saline with blood products. Why is that so important? I'd be tempted to just grab whatever is closest.
It seems like a small detail, but other solutions, even something as seemingly harmless as dextrose, can cause the blood cells to clump together, making the transfusion ineffective and potentially dangerous.
Wow, it's amazing how even seemingly minor details can have huge consequences. They also covered the different blood components and when you'd use each one.
Right, the packed red blood cells for increasing oxygen-carrying capacity platelets for clotting issues, fresh frozen plasma for various coagulation factor deficiencies.
It's like having a whole toolkit of blood products at your disposal. I was curious about why they emphasized warming the blood before transfusion.
That's to prevent hypothermia, especially in patients receiving multiple transfusions. And they were adamant about never using a microwave.
Good to know. I can't imagine that would end well for anyone involved. They also mentioned circulatory overload as a potential problem if the transfusion happens too fast.
Right, it's essentially flooding the circulatory system, which can put a strain on the heart. Monitoring those vital signs, heart rate, blood pressure, lung sounds throughout the transfusion is crucial for catching any early signs of trouble.
It's like walking a tightrope. You need that perfect balance to ensure the transfusion is both effective and safe.
And speaking of balancing acts, let's move on to another area where nurses need to be masters of multitasking, managing all those different tubes.
Okay, we've navigated the world of IVs, tackled diabetes, even braved blood transfusions.
Yeah, it sounds like we've been through a lot.
But this masterclass didn't stop there. They also dove into some core nursing skills that are super relevant for the NCLEX.
Absolutely. These are the foundational skills that go beyond just knowing the facts. The instructor really emphasized the how and the why behind these essential procedures.
Right, like with emergency care, they broke down that whole triage system used in the ER, which always seems so chaotic in medical dramas.
It's all about prioritizing patients based on the severity of their condition.
Right.
Remember those categories, emergent, urgent, and non-urgent?
Yes.
The NCLEX might throw scenarios at you to test your triage knowledge.
So a trauma victim coming in after a car accident, that's an automatic approach.
Exactly. While someone with a sprained ankle, even though they're in pain, would likely fall under urgent.
And they highlighted how crucial it is to constantly reassess patients in the ER. Their condition can change so quickly.
It's a dynamic environment where nurses need to be ready to adapt and prioritize on the fly.
Speaking of high-pressure areas, they also covered surgical care, which always felt like a whole different ballgame in nursing school.
It's a team effort, and the instructor did a great job walking you through the entire perioperative process, pre-op, intra-op, and post-op, highlighting the key nursing responsibilities at each stage.
They emphasize things like getting informed consent before surgery, prepping the surgical site, and all those post-op assessments to watch for complications.
And let's not forget pain management, a crucial aspect of surgical care that often shows up on the NCLEX.
Oh yeah, for sure.
They were big on using a variety of pain relief methods and stressed the importance of those regular pain assessments.
Right, because pain is so subjective.
Exactly. What works for one patient might not work for another. It's about listening to your patient and advocating for their needs.
Absolutely. Now let's talk about the bread and butter of nursing vital signs. It seems so basic, but it's the foundation for so much of what we do.
Knowing those normal ranges for temperature, pulse, respiration, blood pressure, and oxygen saturation, that's essential knowledge for any nursing student.
The instructor really drove home the importance of not just taking vitals, but also knowing what those numbers mean and when to take action.
Exactly.
Right.
Recognizing abnormal vital signs and understand the potential causes, that's what separates a good nurse from a great one.
They also talked about pain assessment as the fifth vital sign.
Right, because pain can be an indicator of underlying issues.
Yeah.
They emphasized using a pain scale that's appropriate for the patient and really listening to their description of their pain.
It's all about that holistic approach to patient care.
Exactly.
Okay, and lastly, we can't wrap up this deep dive without talking about medication administration.
Another core skill where the NCLEX will definitely throw you some curveballs.
Oh, yeah.
For sure.
They went through all those rights of medication administration, right patient right, drug right dose, right route, right time, right documentation, plus those crucial 3 checks before giving any medication.
It seems repetitive, but those steps are in place for a reason to prevent potentially life-threatening errors.
Absolutely. They also covered the different routes of administration, like oral, sublingual, intramuscular, subcutaneous.
And the different types of medication orders, routine, PRN, stat. It's about understanding why one method or order is chosen over another.
Wow, this masterclass really did cover it all. We've gone from acid-base imbalances to IV tricks, from diabetes management to the intricacies of blood transfusions, and finally to those essential nursing skills that form the bedrock of patient care. It's been quite a journey.
And you know, that's what's so amazing about nursing. It's a constantly evolving field that challenges you to think critically, problem solve, and always be learning.
You've just absorbed hours of content in a fraction of the time, but remember, this was just the spark. Now it's your turn to take this knowledge, dive deeper, and start connecting those dots. Imagine yourself in those clinical scenarios. What would you do?
Because that's where true mastery begins, applying this knowledge, asking questions, and never being afraid to learn and grow as a nurse.
This deep dive has equipped you with a roadmap to navigate the vast world of nursing. Now go out there and ace that NCLEX.